I'm going to talk about the abstract 3036 at ASH this year on the topic of prediction of resistance to hydroxyurea therapy in patients with polycythemia vera, a machine learning study, so-called PV-AIM study. This is a rather unique project because typically what we do for polycythemia vera patients, once diagnosis is made, we assess the thrombotic risk and we give patients cytoreductive therapy to decrease the blood cell count. And the hydroxyurea almost always is the number one choice in the community setting in the United States. Hydroxyurea kills cells that grow, and with that, we know it does decrease the risk of blood clotting and the risk of dying. However, the prediction of its efficacy has never been attempted really, truly, and therefore this particular presentation is very important. The patient data was used from the larger database called US Optum database. This is the database that contains the millions of different patients' data in electronic form, including the clinical observations, weight, blood pressure, hematological laboratory parameters, including the blood cell count, hemoglobin, hematocrit, white blood cell count, and of course the therapies. And that was the key for us to engage in analysis of this database, which eventually identified almost 83,000 patients with polycythemia vera, among which about 1,300 would be available for analysis for purpose of identifying characteristics of the patients while on hydroxyurea that would lead to a failure of this therapy. The model, in short, was developed from the laboratory and observational data for these patients, and when validated, showed a high degree of accuracy for predicting resistance to hydroxyurea in patients treated in community setting in the United States. The model was used to identify variables of greatest importance for predicting resistance, and the question was which two variables together provided the most significant association for predicting resistance, including synergistic associations. Of the multiple pairs of variables investigated, and all of them were available from electronic database, so basically anything and everything that was available was analyzed. Hemoglobin and red cell distribution width had the highest degree of synergy, indicating that together these pair of variables were more greatly associated with hydroxyurea resistance than expected, or any variable alone. This pairing was then investigated further, and threshold values were identified with the greatest association with hydroxyurea resistance. Basically, for red cell distribution width, RDW so-called in everyday practice, the threshold was 17%, and for hemoglobin it was 15.5 grams per deciliter. And so applying these particular measures, we were therefore able to develop an algorithm where we would be able to provide to the clinicians in a community setting a decision tree in a way for identifying patients who are on hydroxyurea with a goal to decrease the thrombotic risk, but that are projected not to do very well, calling perhaps for improvement in hydroxyurea dose or schedule, or considering alternative dosing or alternative therapies that would alleviate that increased risk of thrombosis in these patients. So in summary, by analyzing real-world evidence through machine learning, we have identified two standard laboratory tests, hemoglobin and RDW, that are strongly associated with the development of resistance to hydroxyurea.